welcome to this episode of Buncombe Life. We are going to talk today about issues affecting, I want to say seniors, but really it's everybody. Because if you're not a senior, hopefully one day you will be, or you know one. So this episode is definitely for you. We're out here at the Council on Aging, and I'll come back later and tell you more about that, but it's a beautiful place out here, and they have a lot of information to share. But first, let's go and talk about identity theft for seniors. You know that's a problem for everyone. It's really a big problem for seniors, even here in Buncombe County. So stay tuned. I'm here at the Sheriff's Office with Lieutenant Helen Hall. And we've talked before. If you're a fan of the show and you've seen us before, I've been talking to Helen about dogs, but we're not going to talk about dogs today.
No, not today.
Not today.
Not today.
Not today. Today we're going to talk about issues facing all of us, but mainly today seniors, and that's identity theft.
Yes.
I wish it didn't happen. I wish it wasn't true. I wish we could say nobody has to worry about it, but we all do. And this is the sad thing. Seniors have to worry just a little bit more because they seem to be the ones people are focusing on now.
Yes, ma'am, because they're more trusting.
And so that's why, and that's one of the questions I was going to ask you, Helen. Why is it that seniors seem to be the ones people are going for?
Well, first of all, if you think back, the age that seniors are.
Yeah.
All right, we didn't lock our doors. We didn't have to. We didn't have the issues. We may have had some prescription issues with people taking our prescriptions, identity theft, some money issues with people taking our money, but it wasn't as prevalent as it is today.
When they were growing up, this
Exactly.
did not happen.
We didn't lock our car doors.
Sure.
We didn't lock our front doors. We didn't lock anything up, and now we're at the point where we don't have that luxury.
So we're now, seniors especially, have that mentality though, growing up all through that of trusting.
Yes.
And you have to say that by the time you become a senior, hopefully if you're lucky, you have a little bit of savings. Maybe you don't have all those expenses that you once had.
Exactly.
And so they think, hey, here's some money, here's some people with good credit, we can go after them.
Right, especially the good credit, because, you know, when you're younger, you may have a few slips, something happens, you don't get the money to the bank on time, you may have a bounce check or something. You get older, you've made your way, you've raised your children, you've paid your bills, and now you're just a little more comfortable, like you were saying. To me, that makes them a potential victim because they have the money. Everyone knows when the Social Security check comes. Everyone knows when they're going to have the money. And if it comes to the house, if it comes to the mailbox, then, you know, they have to worry about someone getting in their mail and messing with their checks. If it's a direct deposit, it's a better thing. But our older people, you know, if you think about it, they're a little more leery about having direct deposit.
That's true. And so that brings us to some of the things that we need to encourage our seniors to be aware of. All of us, really.
Yes,
but
everyone.
More specifically them, is if they've got friends and family coming into the house, asking questions, wanting to get into stuff, if you've got suddenly somebody who wants to borrow money, that should be a red flag.
It should be. Or you have someone that comes to visit you. You know what, we hope our children and grandchildren have the time to come visit us.
Yeah.
Unfortunately, they generally do not. But if you start to see more visits from anyone in your family or anyone in your neighborhood,
Right.
definitely that's a red flag. Why are they there?
Identity theft, they say, is a crime of opportunity.
Yes.
And we need to get rid of any opportunities that we can. And one is mail that comes to your house. And a lot of us do have the mail coming right to our door, but they do say that if you receive any kind of payment or anything like that, a post office box is a good idea.
It is, and another good idea is to take your name or put your name on a list where you don't receive those credit card offers.
That's the truth. Now, credit card offers that come to you,
Horrible.
get rid of them. And there, we can put some information on screen that will help you, a number to call.
Right.
Make those things stop coming. That's ridiculous.
It is.
But they do get stolen,
Yes.
and people will turn in a credit card with your name on it.
It's very easy to do.
Yeah.
Very easy to do. Also, if you happen to get them, make sure you shred them. Don't just throw them in the trash.
Oh, that is a good point. So the ones that come should be shredded.
Yes, make sure that you shred them. You don't leave anything to where anyone can piece it back together.
That's right, because they will.
Yes, yes.
They will. Now, if any of the folks at home, if this has raised a red flag for them and they go, ooh, I think I may have been a victim of identity theft, what can they do about that?
I would start out by calling the sheriff's office or police department.
Okay.
Let's get that started, get a report made, and let us start to investigate that. Also, I would contact the bank or the credit card company, wherever they think they've become a victim. Certainly, if they get a phone call from someone and the credit card company says your account's been hacked or whatever, call this number. Don't call that number. Call your bank, the number that you know. Okay, never call the number they give you, because they can give you any number.
That's right.
So call the number that you know, and then check from there. And if somebody comes to your door or calls you up and says you need to come to the bank, I'm going to meet you at the bank. There's a problem with your account. Take family with you. Go inside of the bank to conduct your business. We don't conduct business outside of the bank on the sidewalk.
Right.
We don't conduct it at the grocery store. We don't meet them at an ATM after hours.
Right.
Okay, we go inside the bank to conduct our business.
Right. And some people watching will go, well, all these things, that's duh. It happens. It happens here.
They are so smooth.
Yes.
Before you know it, they've got your identity,
Yes.
they've got your life, and then you spend years trying to straighten
Yes.
it back out. And for our seniors, they have worked all of those years to build that.
That's right.
And now somebody's trying to take it away.
The number one thing is to be aware.
Yes.
And
be
so
aware.
we hope we've made you a little more aware. If you have any questions, we'll put the numbers on the screen. You can give the folks here at the sheriff's office a call, and they will be happy to help you. And don't go anywhere. Stay right there. We'll be right back.
Hello? Who? I don't recall entering a sweepstakes. Tell me about the sweepstakes. No, I don't recall that. You're right, maybe a friend put my name in. What? Really? I won? Oh my goodness. I never win anything. What a surprise. How much? Oh my goodness. That's a lot. What a great day. Oh, wait a minute. I need to write that down. Okay. You say I need to send a check? For how much? Oh, my daughter in Virginia and my best friend Louise will be so excited. They absolutely won't believe it. So I'm going to get a big check. Oh, I see. I hate to sound greedy, but when should I expect to get that check? Oh, I see. When you get my check. Oh, that's the way it works. Well, this is wonderful. Have a great day. Thanks so much, young man.
Unfortunately, this scenario happens too often. It may have happened to you or someone you know. Before you send a check to a stranger, please check it out with law enforcement, a trusted friend, or a relative.
I'm here with Jennifer Stewart, part of MAHEC's Advanced Care Planning Coordinator and the Center for Healthy Aging, right?
Yes.
Okay. Thank you, Jennifer. If you've been watching, you know we're talking about aging issues, and I like to think that that's not an issue I have, but somebody told me once, if you just keep living, you're bound to age, and that is so true. It sneaks up on you. You're 25 yesterday, you're 50 today, you're 70 tomorrow, if you're lucky.
Right.
But there's some planning that comes with that aging, and this is what we want you to hear. So tell us, and I know what you do with MAHEC is you teach people how to do this planning for aging. So we're just going to talk about it. Some of the things what are some of the things that people need to plan for? And what age should they start planning?
Advanced care planning is for all adults, though we see the greater need, for say like 40s, and as people do age, they have more chronic conditions and more serious illnesses.
Right. So you kind of want to beat those chronic conditions. You kind of
Yes,
want to have
definitely.
this done. So what are we talking about? Planning for what?
Well, so advanced care planning is it's a process of thinking about your end-of-life choices or health care when you reach the end of life, or if you face a serious crisis or illness. You might be faced with some issues. Say you're in the emergency room and your family has to make those decisions for you. And so by using advanced care planning, your family has a roadmap of kind of some choices, some guidelines that you have already talked about with them.
So you could really divide this almost into two pieces, because advanced care planning doesn't necessarily mean you have to be older, because I can end up in the emergency room for a myriad of reasons. If I haven't done any planning, my family doesn't know what to do with me.
Right.
And then again, as you age, the more chances of you getting to those issues is more likely.
Yes.
So it's really, really for anybody.
Oh, it is, yes.
So what kind of stuff do we need to be doing?
Okay, I've broken it down into some steps just to make it kind of simplified. But advanced care planning, like I said, is a thoughtful process. And so you want to start with a conversation. Begin that conversation with your family, your loved ones, about what your goals of care for health care would be, what your values are. Talk with your faith leaders about any guidance they have for care. Think about like where you would like to be when you reach the end of life. Would you prefer to be, at home, in a care setting, or some type of modified like hospice?
Kind of goes into that category here in the South. People say, "Don't you ever put me in a nursing home."
Right.
Yes. And that's making clear that you would rather stay with your loved ones or in your home as long as possible.
Yes.
If that's your wish, there are ways to make that happen.
Yes, definitely. Yes.
Okay.
Step 2 would be to select a healthcare power of attorney. That would be someone who represents you. So when you're unable to make decisions for yourself, your healthcare power of attorney is making those decisions for you.
Is that the same thing as a healthcare proxy?
Yes, yes.
Okay.
The other name would be like a healthcare agent or a healthcare power of attorney, right?
Okay.
And the qualifications for that, they have to be 18, so the person has to be 18 years or older. They don't have to be a family member. It can just be someone of your choosing that you feel like can make decisions. It's best if it's somebody.
Document. That's a legal document, isn't it?
It
Give
is.
people that power to do that?
Yes.
So would you say that is somebody who's older needs to do that, or how about somebody in their 40s? Is that something they should have prepared?
Oh, do you mean like
to give the healthcare proxy, to give somebody, if something happens to me, that you can make those decisions for me?
Oh, definitely. From any age, you need to go ahead and have a healthcare power of attorney. That's probably the most important step after those discussions would be to select the person.
And I think that's huge, because I think, in my mind at least, that's something that somebody 65, 75, 85, 95 is doing, not me. I don't need that. Gosh, I don't need that. And I'm sure, definitely in my 20s, 30s, and 40s, I didn't think I needed that. And what you're saying is, no, you need that.
Yes,
you should
definitely.
have that.
Yes. Okay. The next step, and you brought that up, is that like the healthcare power of attorney is a form. It is a legal form. So once you've had these discussions with your family and talked with someone and asked them to be your healthcare power of attorney, then take that next step to make it legal and complete the healthcare power of attorney form, or I don't know. Okay, we often recommend the 5 wishes form, which is, it's not quite so legalese as the state form. There is a state form that you can use as
Where
well.
can somebody get this?
Healthcare providers.
Okay.
Most family doctors carry 5 wishes. If not, you can contact me, which will give that information, and I have them also. But this includes the forms to designate your healthcare power of attorney, as well as a place to chart what your wishes are. So it reflects the discussions that you've already had about what healthcare you want, what decisions you want to make.
Right. And so this is a discussion that can be very difficult for people to do.
Yes.
And that's one reason people put it off. And probably one of the reasons it ends up being one of those later in life discussions is because nobody wants to talk about it.
Right. It's very difficult to start. I have a list of some of the frequently asked questions that often come up. And so the first thing that someone asked me about with advanced care planning, it was two things. Is a lawyer required? And does it cost money? It doesn't, neither one. It doesn't require a lawyer, though if you have more complicated issues, we have lawyers on our community initiative, and then we can direct to a best source to help you
that would be
for
great.
that.
Yeah.
And then there's no money required either. This is just complete the form and have it signed, witnessed, and notarized.
That's wonderful.
Yes.
What are some other questions?
One other question is, say, is it permanent? Can I change my mind? And yes, you can change your mind. In fact, we recommend that you review your advanced care plan. If you're younger, you can review it every 5 years or so. As you age, and if you have rapidly changing health care, you might change it after something new develops, and then revisit it. And if you move, you'll need to redress your advanced care plan for that state.
Now, do you need to, I know this includes a will and all that, does that need to be filed anywhere, or as long as you keep it with your information?
Super question, yes. You need to keep the main copy of it with your records wherever you keep them, but also share a copy of it. It can be a photocopy with others, so like your physician, the person you've chosen to be your healthcare power of attorney. There's some places.
To make sure that they have a copy of it
Yes.
also. And keep that in a fireproof box, if at all possible, because I know sometimes things get lost.
Yes, yes. Nope.
Anything else you want to share with our folks?
The Western North Carolina Advanced Care Planning Community Initiative is a great resource for anyone. We are made up of healthcare providers, healthcare institutions, lawyers, individuals who are just interested in helping people with their advanced care planning. So that's a great resource that I can direct you to.
And would you say that I'm sure this has come together, and one of the reasons we're talking about these issues is we have a rapidly growing aging population.
Yes.
That part of our population, not just here, but across the nation, is growing. We're living longer.
Yes.
Which is a good thing.
It is.
But
it opens up many more choices for health care
and
combined chronic conditions. You have many more choices to take.
And different ways to look at how to provide for those folks.
Right.
And all of us, as we age and as we grow older, there's different ways to do that than there used to be. So that's part of what that initiative, I'm sure,
it
has
is.
come together
Yes,
for.
yes.
Thank you, Jennifer, and we will put all your information on the screen so that if any folks at home have any issues and any questions that we've left and that we didn't answer here, that they can call you or with any of their concerns.
Okay, super. Thank you, Kathy.
Okay, I'm glad you stayed with us because I'm here out in this beautiful little section here in front of the Council on Aging, and we'll talk more about that in a minute. But I'm here with John. Pronounce your last name for me.
Wingerter.
Wingerter. I'm so glad I asked him to do that. And you are the Education and Outreach Coordinator for the Council on Aging.
That's correct,
Okay.
Kathy.
He's joined us today for some stuff that I find fascinating, and I know you will too. Medicare. If you're 20, you're not going to listen to us. But for anybody, I'm going to say over 20, please pay attention because you've got family who need to hear this. Medicare. Tell me a little bit about that, because we are all, if we keep living, like the Council on Aging says, if you keep living, you're going to get to the part when you need this. What is Medicare?
Well, Kathy, Medicare is an insurance program that's designed for people who are age 65 or older, or if you're under 65 and on disability payments from Social Security, you are also eligible for Medicare.
For Medicare.
But basically, it's an insurance program for our senior citizens here in the United States.
And that's key right there. Do you hear what he said? It's not really a government subsidy, it's an insurance.
It's insurance and it's not subsidized health care,
Right.
which means because it is insurance, there are rules and regulations that you have to follow
Right.
when signing up for the various parts of Medicare.
Right, so when you get 65, it's like they're saying you're going to need this because it's going to be hard to get insurance otherwise.
It would be very, very difficult to get insurance the older you get. The commercial insurance companies don't want to provide health insurance for older people. It's very high risk and it'd be extremely expensive.
Yeah.
Even though Medicare has some premiums and there are some costs, it's not entirely free.
Right.
You do have to pay certain parts of for certain parts of Medicare coverage. However, it's much less expensive than you would ever find in the commercial marketplace.
Right, so if you're near 65, you need to pay really close attention. If you have somebody in your family that is, you need to. Some of the myths I want to bust here really quickly
Okay.
with you, and we talked about this just a few minutes ago before you joined us, is that one plan of Medicare, there's lots of plans out there, one plan fits all. Not so.
Not so. Medicare has various parts. There's the basic medical part, and that pretty much applies to everybody. However, you also have to purchase separate plans for your prescription drug coverage, and that certainly does not fit everybody because all of the drug plans have different formularies, different prices, and you need to come in and talk with a Medicare counselor to find out which plan best meets your needs.
Right.
We also advise people that they may want to purchase a Medicare supplement because Medicare doesn't pay for everything. A lot of people purchase a Medicare supplement to cover those holes or gaps in the Medicare payments. Thus the term Medigap policy or supplement policy, it's the same thing.
Right.
And again, there are a lot of different policies, and the fact that that a lot of people don't understand that the policies are standardized, and so that if you purchase a policy A or F, it doesn't matter which insurance company you purchase it from. Everybody's benefits are the same, even though the rates that they charge will be very, very different. Some people will pay $100 a month more for the exact same coverage that their neighbor may be purchasing.
And see, that is key because so many times you'll have friends that say, oh, I got this is the greatest policy, this is wonderful. Well, it may be for them, but it may not be for you. And so you do need to compare different policies.
Absolutely, absolutely. I hear that all the time. My neighbor down the street has this plan, and my neighbor said it paid everything. Well, that's not a function of the insurance company so much as that's the benefit design that they selected.
Right.
They may be paying way too much for that particular policy. And what they can do is they can come into the Council on Aging and we will show them what the various policies cover, and we can go to the Department of Insurance of North Carolina website and show them how much the policies how much the various plans are charging for those policies.
Right. And it's key, two things you said there that I want to stop on. One, there is help. If you're confused, and this is confusing for me, what to do with this, there's help. Council on Aging can help you. Your help is free.
Our help is free. It's unbiased. We don't sell anything. We're not recommending any particular insurance companies or insurance brokers or agents. They're all good. They've all been approved by the state of North Carolina. But since we don't sell anything, our job is to simply help the people understand what the policies are all about, and to help them make their decision based on unbiased information.
And they should not be ashamed to say they're confused.
Absolutely not. Absolutely not. We have people from all walks of life. I can't tell you how many university professors that we come into my office, and they have their doctorates and they have all this education, and they say, John, this is overwhelming. I don't understand it.
Thank
and
you.
we sit down and we explain it to them. And virtually everybody who leaves our counseling sessions is very, very satisfied with the amount of information, with the knowledge that they take away from these sessions. Again, they're free,
Right.
they're unbiased, and open to the public.
Right. And there's something else I want to touch on just for a second, and that is you do need to take it because there's penalties if you don't and decide later that you want to.
Yes, that's a very good point, Kathy. What happens is people oftentimes think that they don't have to sign up right now and they want to wait, and they wait several years. Well, if they wait several years to sign up for the prescription drug coverage or for the Part B of Medicare, then there are penalties that they will pay. They're going to pay a higher premium. And the bad thing about that is those penalties are permanent.
Right.
They can never get rid of them. So it's in their best interest to sign up for those coverages when they're first eligible to avoid future penalties.
Absolutely. And y'all will walk everybody through that. They just need to come out and see you.
We will walk everybody through that. We have a lot of wonderful print information, and we will be happy to spend all the time necessary. Over 2,000 people a year take advantage of our Medicare counseling services.
Well, now, are there any other myths or fallacies out there that you want the folks at home to know about that they just need to be aware of?
Yes, I think there's been a lot of concern about the Affordable Care Act and how that might be affecting Medicare. I can tell you that there have been a lot of improvements under the Affordable Care Act. A lot of preventive services have now been added to the program, and this thing called the donut hole. Some people have heard about this coverage gap or donut hole. That is being closed slowly but surely through a variety of mechanisms, and that's all good. It's all good for our senior citizens.
That is wonderful. So if you've listened and you said, you know, I need help, all they have to do is give you a call. We'll put the information on the screen, give you a call, or come out here to the Council on Aging. You guys are easy to find. Thank you, John.
Thank you.
I hope you've enjoyed this episode. We've learned a lot about identity theft. I hope you'll remember those tips. We've learned about end-of-life issues. Hard to think about, but something you definitely want to think about. And we talked with John about Medicare. Again, so much good information, things that you can do better to save money. If you can't use these for yourselves, I hope that you'll use these tips for someone around you. And then I want to talk about the Council on Aging. We're out here. That's their offices right here behind me. It looks like a church. It is a church. They're in the basement of a church, the inside Deerfield. And I know if I was driving up Hendersonville Road and saw that the Council on Aging was in there, I would almost wonder to myself, can anybody go, or is that exclusive? It is not. The Council on Aging is for anyone. So I urge you, if you have any questions about anything you've heard here today, really, they can help you with it. They've got tons of information, a great website. And one thing we wanted to leave you with, and that's the Senior Health Insurance Information Program classes that are going on. Council on Aging is the representative here in Buncombe County. These are great classes for information for people, seniors on insurance, but it's not exclusively for seniors. The classes are for anyone who wants to learn more about senior health insurance issues. If you would like to attend a class, want more information, please contact the Council on Aging and they will tell you all about it. And again, like every month I say, stay tuned because you never know where we'll be.